Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a maternity pediatric chiropractor, a functional medicine practitioner, and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today, I'm talking about the topic of the importance of gut health and mood symptoms, and my special guest is Dr. Tracy McCarthy. Dr. Tracy McCarthy, MD, is a board-certified psychiatrist and Institute of Functional Medicine certified physician with over 2 decades of experience supporting thousands in transforming their health. She's the creator of the Natural Mood Solution online program and the founder and medical director of Dr. Tracy McCarthy Functional Medicine, where she brings a wealth of expertise to her practice. As a wellness thought leader and in her premier medical practice, Dr. McCarthy is dedicated to helping adults suffering from depression, anxiety, brain fog, fatigue, digestive issues, and hormonal imbalances by identifying and addressing the overlooked cause of these chronic health symptoms. Her approach focuses on underlying issues such as microbiome imbalances, nutrient deficiencies, and toxin exposures, empowering her patients to regain their health and vitality. Known for her caring and supportive approach, Dr. McCarthy ensures her patients feel validated and seen through their health journeys. Her holistic method provides her with the guidance, structure, and compassion they're looking for, with a bigger picture of their whole health finally the focus. When Dr. McCarthy isn't working with patients or educating about health, she can be found spending time with her family. She lives in beautiful Northern California with her husband and 2 growing boys. She enjoys going to the gym several times a week, traveling, and loves taking walks with friends and her dog. And for more information, you can find her on the web, Instagram, and Facebook at Dr. Tracy McCarthy. Hi, Dr. McCarthy. Welcome to the show. I'm very excited to have you on today.
Thanks for having me. I'm so excited to be here.
Yeah, so I want you to tell the listeners a little bit about who you are and how you kind of came from the world of psychiatry into the world of functional medicine.
Yeah, I'm happy to explain that. I'm a conventionally trained psychiatrist. I'm an MD, so trained in allopathic medicine, and didn't learn anything about the stuff I'm doing now through my conventional medical training. I did learn a lot of really great stuff, but it wasn't the toolbox that I ultimately have found so useful with my patients. When I was in residency, I was getting increasingly frustrated by the limitations of the tools I could offer patients. And they were frustrated too, because, many people have limited response to medication. They end up on multiple medications and still don't feel great. They have side effects, or they're wondering, do I have to take this forever? There's a lot of problems with that. And I really was frustrated by the feeling that this was not addressing the root cause, because I went into medicine wanting to understand what happens. Why do people get sick? What can we do about it? I'm really wanting to understand what's happening really in the body with the biochemistry, at the root. And so I was lucky around this time that I was becoming so frustrated to find information on inflammation, chronic inflammation, and how that manifests as different symptoms and how diet and lifestyle can influence that. And that was just very eye-opening to me. And also kind of made me mad. I was wondered, why didn't I learn any of this in medical school? Like this research is there.
Right.
Why was this not part of my education? And I really went down that rabbit hole, and I was kind of addicted to it. I could not do that then. I had to keep learning. And then I was wondering, how do I started to apply it in my own life. And my husband, we made dietary changes and all kinds of little things felt better. And we're like, and I kept wondering, could I do this with my patients somehow? And eventually found the Institute for Functional Medicine and did my training in this approach. So excited to find a group of people that, have the same beliefs about how we can apply this research and this information to our patient community. And then ultimately realized, gosh, I need to open a private practice. At this point, I was working in a psychiatric hospital.
Oh, wow.
I didn't have influence over what patients were eating or...
it was limited.
Yeah. And it's important. It's acute stabilization that needs to still happen, but it was very limited. That is the word for it. So I had to figure out how to open a practice and begin to do that. And I started with first just recommending dietary changes to people, and then saw improvements, and then started working on their gut health, saw more improvements, started really working on toxin exposure, detoxification, and the progress just mounted and mounted. And, all of this experience and tons of further training have brought me to where I am today, where it's so wonderful. I'm so blessed because I get to work with people in this partnership, really empower them to understand what's going on in their body and to let the body do the healing that it's trying to do.
Yeah, that's so beautiful. It must have been so hard in the beginning to kind of have known what you known and then been like, oh my God, there's this whole world out there regarding health, regarding helping patients, which is why you became a doctor that you didn't even know existed.
It was there. I definitely went through some adjustments in my mind because, one of the books that had a huge influence on me was Dr. Weston A. Price's book, Nutrition, Physical Degeneration, which I encourage anybody to look at. And it's just such a great story. And I realized, through that book, it really just changed my paradigm, which was, we evolved to be healthy. We're meant to be healthy. So where's the mismatch? What's going on? Up until then, I really thought like genetics is just determining your fate. And gosh, I hope I don't get this thing or that thing. And there's nothing I can do about it. And that was a major shift for me and really still informs everything I do.
Yeah. And it's interesting because that is such a ingrained cultural belief that is not just part of like allopathic medicine training, but it's really people just believe that, like, or I get sick because I was exposed to a virus, right? Like these are just like the beliefs that people have that still have to this day about what health and illness are. And we just recognize that, the germ theory has been disproven and there's something called epigenetics. So like we have a lot of power.
Yeah,
it's really
matters.
Yeah.
Sorry.
Yeah, it's really empowering. And we can take control of how we manifest health in every aspect.
Exactly. There's so much that we can influence. It's really amazing and wonderful. And I see that very much in mental health. There is this attitude a lot of the times that like, well, depression runs in my family, so I'm just like fated to have it.
Right.
And it's like, no. The epigenetics, just like you said, you can influence so many things.
For sure. So now you work with a lot of people, and I know a big part of your practice is gut health and the connection of the gut with the brain. The gut is our second brain. So you want to delve a little bit into about gut health and how it's very much impacts our emotional state?
Yeah, it does so in so many ways. So it is really foundational, which is why it is a big part of my work I do with folks. There's a lot of ways that the gut is influencing our mental health. First of all, the role of the gut is, of course, to assimilate our nutrients, right? Like digest, break down, and absorb our food so that we can live. So we can do all the daily, tasks of building proteins and having energy, all the things we have to do. And if the gut's not working right, that's not happening. So then you end up with various deficiencies, which means you can't have a system working properly if you don't have all the pieces you need for all those biochemical reactions, all those building blocks. So that's just the first sort of more obvious piece of the role of the gut. But it's a big one. And I see lots of patients with various deficiencies because of poor absorption. Maybe they don't have enough stomach acid, or they don't release digestive enzymes well, or there's bacterial overgrowth competing with that absorption. So there's that aspect. But the next one is really about the microbiome. So, I'm sure your listeners have heard of this from you before, but the microbiome is, all the bugs living on us and in us. And the bulk of that is in our gut. And those bacteria, largely bacteria, but it's also fungi and viruses and even sometimes parasites, different things. These are influencing our entire system. They make all kinds of compounds and they have all kinds of roles. And when we have an optimal microbiome, they're doing a lot of jobs for us. We've really outsourced a lot to these bacteria, from an evolutionary point of view. They are helping detoxify. They're making compounds that we need, to fuel the lining of our gut, to help us calm inflammation in the body. And when we have the wrong bacteria overgrown, they're doing things that harm us. They're creating inflammation. And so they're making compounds that are absorbed into our bloodstream and are affecting our immune system, our nervous system, our hormones. And we also, even fascinatingly, I think, experience these compounds from bacteria traveling up our vagus nerve. So that's that longest, nerve that comes from the brain that innervates all our intestines, our gut, our abdominal organs. And there's this chemotaxis of these compounds moving up to the brain through the nerve. So, and we keep finding more and more ways that there's this cross communication between the brain and the gut. Yeah, I've been talking about ways the gut communicates with the brain, but the brain also communicates with the gut. So this axis, this feedback loop is extremely important for our well-being.
Oh my God, it is. I actually have never heard of that before. I do a lot of work with the vagus nerve because I'm a craniopath. I'm opening up the exit in the skull where the vagus nerve comes out to make sure that there's full communication there and helping that body be more in the parasympathetic state of rest and digest. But holy crap, these bacteria are going up that long vagus nerve.
Well, the compounds they produce are.
Oh yeah, that is fascinating.
It is really crazy. I feel like we are still just scratching the surface.
There's so much we don't know, right? Like there's 10 bacteria to every human cell in an healthy adult body.
They're definitely outnumbered.
Right. And I talk to a lot of, when we have guests come on that talk about microbiome development in an infant, we talk about how to set the stage for that healthy microbiome because that infant exposure, right, the type of birth they had, whether they're breastfed versus formula, did mom get antibiotics during the birth? All of these things will, the skin on skin, tummy time, all of this will impact that child's health for the rest of their life, right? So I know with functional medicine, those are some of the questions that you ask your patients. It's not like, oh, just currently what's going on in your life, but you want to know this person's entire life history. Did their mom get antibiotics when they were pregnant with them? They may or may not even know that, but these are really important factors that will impact that person's overall health.
Yeah. And we see it all the time. I do take that timeline, that history that you're referring to, and you can see, in certain cases where it's like, oh, they had some of these factors you're describing, maybe C-section birth, maybe for a lot of times formula feeding. My patients, a lot of them are in their 50s and 60s, and that was so common in that group. And then you see the colic they had as an infant, and the ear infections, and then the chronic constipation. I mean, it definitely is a common thing that it goes back. And I'm always just in awe of how, again, kind of getting at that, what we were just scratching the surface, but the microbiome, the vaginal flora shift in the last few weeks of pregnancy. So even preterm birth can affect which microbiome, this baby receives. It's so amazing.
Yeah, that baby's first meal is going through the birth canal and swallowing mama's vaginal flora. And that is on purpose to seed the mostly sterile gut tube and get the bacteria that are most in line with that baby's genetics are going to match at least 50% mom's genetics, right?
Yeah. Exactly.
It's so fascinating.
Your mom has a healthy microbiome.
Right. And then there's a lot of things mom can do before the pregnancy, right? We're doing this preconception type work to get her healthy microbiome, gut and skin, vaginal, all of it, right? It's all connected, right? And getting all of the microbiome healthy before the pregnancy, during the pregnancy to help healthier vaginal delivery.
Yeah, and that's such a great point because here we're talking about these factors that can happen, when mom was born that, influenced her gut. But these are things that we can still change. Like the food we eat has a major impact every day on which bacteria we're supporting the growth of. And then, of course, there's more complex things we can do with probiotics and treatments, working with a functional medicine provider. You can shift that microbiome in a major way. So it's not like you're stuck with what happened when you were little.
Well, that's the bottom line. And I think that's the empowering part here is that, and even as parents, it's like, oh God, I had to, give my child an antibiotic or, I had an emergency C-section. It's not about guilting or shaming what's happened. It's recognizing that's important information to know for our health or for our child's microbiome health. And then all of the great things that can be done to shift that and change it, right? Because this is a fluid thing. It's not like, oh, that happened and there's nothing we can do about it.
That's exactly right. The reason to note that it happened is to know, oh, good, now I have that information and I can respond to it to do something to support, remediating that or something. That's, I do feel very strongly about that too. It's not about people feeling depressed because they had to have a C-section. That's the last thing we want anyone to feel.
Yeah.
So.
For sure. So talk to me about maybe some of the patients you've had in your office that were having different types of mood symptoms, and then you were able to shift those mood symptoms by addressing gut health.
Yeah. So, tons of examples of this. I kind of want to give you a little bit of variety of them. Sometimes it's a nutrient issue, right? So I had patients where they had severe B12 deficiency, and that was the reason of their depression. And that was actually quite an easy fix, but they weren't absorbing it because they didn't have enough stomach acid, which is required for absorbing B12. So correcting that was really pivotal. And that's improving that digestion, that function of the gut. So that's sort of a simple example. I think about one of my earliest cases, who came to me with really bad anxiety. She was even taking Lexapro for that anxiety and had stayed on it because it had helped a little bit, but she was still suffering a lot. She also had irritable bowel syndrome with diarrhea. So she was, she was really stuck. She was a woman who used to love to travel and fly places. And she just felt like she couldn't anymore between her panic and the GI issues. She never knew when she needed a bathroom. So she was really stuck. And, we found a fungal overgrowth, a yeast overgrowth in her gut, another bacterial overgrowth. And working on these, and there's a few other pieces of the puzzle because with functional medicine, we're always kind of looking holistically, and there's more than one piece usually. But the gut was a big part of her change. And when we corrected that, within a couple months, the diarrhea was gone, the anxiety was gone. She was flying with her step grandson and traveling, and was just so excited to be back to living.
Yeah, this is really about quality of life. Like if there's something that's impacting you doing what you want to do, then there is hope that you can shift that and you can make changes to not get stuck.
Exactly. Yeah.
Did you have some other stories?
Yeah. A case that I think is really interesting, but it's less about gut and more about blood sugar, which is another area.
Let's talk about it.
It's very, very important. And it really, I think, also impacts your audience quite a bit. That there's a real, I think, most people just don't know about what's going on with their blood sugar and how impactful that can be. And a lot of folks are riding what I call the blood sugar roller coaster. So it's just going up and down all day. It's not steady. They eat a meal and it spikes too high. And then in response to the insulin your body releases to manage that, the blood sugar plummets. This often triggers an anxiety sensation in people. And it can also cause them to wake up at night. They can have this happen overnight, and then they are waking up from that adrenaline release that happens to rescue the blood sugar. And so then they wake up and they're just really alert. And they're like, why am I so alert at 2 a.m.? And it's because of that unsteady blood sugar. So I just think of a case of a patient with severe anxiety, been to an intensive anxiety treatment center multiple times for the day program. And when we started working together, she just eliminated sugar as a first step. And her anxiety dropped like 80% just from that step. Right? It was just so profound for her. And we see that when we get people doing some glucose monitoring and we get rid of those spikes in the blood sugar, suddenly they're sleeping much better. Suddenly their anxiety is so much better. So, and it can also affect depression for sure. High blood sugar is a real trigger for that. So getting, that's another one of these root causes that people aren't aware of that is so influenced by the food you're eating, and actually also by digestion, because a lot of folks aren't digesting fat very well. And I see that very commonly. And so even if they're eating a really balanced macronutrient ratio, like, not too many carbs, adequate protein, good healthy fats, if they're not absorbing the fats, it can't help stabilize that blood sugar when it's absorbed. And so they're still having that issue. When we fix that, it's a game changer.
And is that just like some digestive enzymes, like some lipase or?
Yeah, it's often bile support in various ways, and definitely can be lipase. And sometimes we have to address bacterial overgrowths in the gut as well.
Oh, sure.
Yeah, lipase is a big part of it.
Yeah. So, this is interesting. Everything is connected. And I think that's what I love about functional medicine is you really are looking at that whole person and recognizing anxiety, for example, or depression are not the root cause ever, right? They're symptoms. All symptoms are never root cause. So when we have symptoms, it's our body telling us that there's some imbalances going on, and we have the opportunity to dig a little deeper to identify the root causes of the symptoms and address them. And typically, like you were mentioning, there are more than one. It's rare probably that it's just a simple, one cause, we're good to go. But working with a functional medicine practitioner, they're going to help you identify all the causes. And sometimes there's even a certain order, right, and a priority that you're going in. So you're peeling back the layers of the onion to support the health of the patient.
I use that analogy probably 10 times a day about the onion. Someone's like, we're just working through the layers, right? And you're so right about the order. I mean, we got to get the gut working better before we detoxify someone. That's going to be a big mess, and yet we got to get those toxins out to get them to the place of like lasting healing. So the order is important.
It is. And, I think also just really educating people about all of the lifestyle changes that can be done, but once again, without overwhelming, right? So doing them at the pace at that, baby steps, whatever that person's able to take on. Like the one thing, like, okay, I'm going to stop eating sugar, or I'm going to, cut gluten out of my life or whatever, where it's not like, okay, I'm going to get up and go on my Peloton and then I'm going to meditate. And then I'm going to that could be too much for somebody who's starting from zero, right?
Yeah. I think multiple changes are too much for anybody at once. I mean,
Correct.
I'm with you on this. I always encourage realistic baby steps. You want the thing that doesn't feel overwhelming, because otherwise you're just going to, either you'll do it for a while and then fall off the wagon, or you won't even ever start because you'll feel so discouraged. So I'm a big fan of baby stepping our way to greater health. And you really see those things add up. That's the thing. People might think this little thing isn't a big deal, but it is. It's that foundation. And then the next, when that's easy, you do the next baby step. And we really see this sort of snowball effect in their health as they walk those steps.
Yeah. And it's exciting. And what I see in my practice is if I have somebody coming in with so many different symptoms and they're really feeling pretty crappy, if you already have a lot of pain and low energy and you're depressed, you're not really eager to make any changes, right? Like, I mean, even though you want to feel better, but it's really hard when you're starting there as opposed to somebody who's already feeling pretty good, who's like, I can make some changes because I have more to give, I guess. So there's more bandwidth there to make a change. So what I find, is I start foundationally with chiropractic adjustments and just getting the nervous system balanced and helping to reduce or eliminate their pain level. And then what I'll see is they're like, I went for a walk around the block today, or I ate, I chose to eat something different for breakfast than what I normally eat that was healthy and nourishing. And these are like small baby steps that I didn't tell them to do that, but they're already just innately like, I'm starting to feel better. And how can I keep feeling better? How can I keep moving towards this paradigm of health? And it is a journey. But all those little steps do add up and make a difference. And they build on each other, because then I think it allows bigger steps and more steps. And then we're like, wow, I'm training for a marathon, and, like whatever it is that this person is moving towards, that could be starting from somebody who's like barely got out of bed before.
Yeah, that's so true. And your example of someone just starting to take a walk, you think about what we know about all the things a walk can do for you, right? So it's like actually quite impactful in all these different areas, and it really is building.
Yeah. And it could be even unconscious, but it's so cool for me when I see that they're like, okay, I'm ready to do the next thing. I'm ready to do the next thing. And then, it's just inspiring to see how people are doing the work, right? Like, cause at the end of the day, you and I can't do it for them, right? It took me a little while to learn that when I first started practicing. I was like, why aren't they, I'm cheerleading them, I'm encouraging them, I'm showing them what to do, and they're just not doing it. And then I realized they have to care more about their health than I do, right? Yeah, that's the bottom line.
Yeah, that's actually a big thing in our psychiatry training, when they're always like, don't work harder than the patient.
Yes.
But it's like meeting people where they are, right? And you're the guide and you're providing the roadmap and the tools that then they have to implement. But I think when they implement, that's so empowering for them. They start to view themselves as someone who does care about their health and takes action. And that's when they start doing more and more of those steps you're talking about.
Yeah. Yeah. It's so cool. So do you have any examples of women that you've worked with that were postpartum and having some mood disorders, whether it was anxiety or depression, that were really, struggling with the baby blues, that were looking for some functional medicine support?
Yeah, there's sort of two categories I think about with postpartum that are pretty important and very common that make a difference for people. I think about a case where there's a patient actually who, before she had her babies, she struggled with really bad OCD symptoms, so obsessive compulsive symptoms, always very related to her menstrual cycle, which was interesting. That's not every case of OCD. And in her case, it turned out she really had low progesterone. And that's that hormone that's produced in the second half of the cycle, for your listeners. So adding some progesterone was a game changer for her. But then, we know that a lot of times with postpartum depression, it is that rapid drop in progesterone that can be a trigger. And so, making sure to be watching for that and bringing that back in, adjusting the level as needed for her was a real important step.
Oh, giving her progesterone after the birth.
Yeah, and it wasn't immediate. It was like when the time was right, but it was, being aware of that as a factor, I think is really important. And then another one I think that's really not well recognized by people, but can be very important, is the zinc and copper ratio. This is a thing that shows up in depression and ADHD, and in other things. And when zinc is low, copper tends to get high. And some people genetically tend to have lower zinc and have to kind of work a little harder to have enough zinc. And that's a big factor in postpartum depression, is often that low zinc, high copper situation. So correcting that can also be very helpful.
Right. And these are things that somebody could easily check in a blood test, right? And have an awareness. I would think somebody with low zinc would also have a lower immune system and more susceptible to getting sick often.
Yeah, zinc has so many impacts. It's one of those key nutrients that I see.
Skin healing.
Top 5 of things that I see as deficiencies that impact mood, for example.
The mood. Yeah, that's really interesting. And to your point, somebody could have a genetic predisposition, but it doesn't mean that they're destined to just have to suffer with these symptoms. Having that awareness means like, okay, maybe they have to take a zinc supplement, right? Or eat more zinc rich foods.
Yep, exactly.
Okay. And then what about like also women that are feeling anxious and depressed and wanting to become moms, but also having concerns about being on a medication, for example, during pregnancy and breastfeeding?
Yeah, I think it's really important to work with a provider who has some knowledge about that. That's really an individual decision. It can, many people successfully are on medication in pregnancy and after, and lactating. And I think that it's important for people to know, like, you and I are both proponents of all these other tools that people can use because, and we do that because people don't know about them and they get at the root causes. But, medication is a tool that for some people is helpful and is important. And if that's the right thing for them and it makes sense, I support that. Like we're not here to judge anybody for using that, right? I always just be clear about that because I feel like, we're so focused on the natural things. It's like, I want to use the tools that work. That's really how I feel.
And at the end of the day, there's all these options and it is up to the patient to choose which option feels right for them. So I think it goes back to that informed consent where we present all these options and then the patient's like, oh, this actually, I want to try this route or I want to go, I want to do this because I think with allopathic medicine, a lot of times the only route given is medication, right? Yeah, and so it doesn't really feel like a choice, or you could choose between one medication or this medication, right? That's still not really.
That's totally right. And that's terrible. I feel like that, and it's not the truth because it's
not the truth. So you want to give all the options. And then to your point, in these cases, medication is one option, right? And so it's good to just have that as, that women just know that there's so many options out there. And once again, it isn't about judging what option somebody chooses for themselves, whatever feels like is the best fit for them and for their family.
And ideally you work with someone who is competent in the medications, but also understands all these other parts because there's so much we can do to like reduce the amount of medication needed. or even
right.
medication, right?
So, right. Maybe they do a mixture, right? They do a lower dose medication along with some of this other support. And it's comprehensive.
Yeah. And some people are really ready to come off of medication, but don't have a provider that knows how to help them come off of medication. And, one of the really unfortunate things I see in conventional psychiatry is that when people come off of medication and have like a return of symptoms, it's seen as proof that they needed the medication, when in reality, often that is a withdrawal discontinuation syndrome situation. And there's a whole number of things we can do before someone tapers a medication and stops it that really increase the odds of that taper and discontinuation going really well. And so it's like you can plan for this, you can make changes, you can do slow decreases, but with giving the brain all the things it needs to be adaptable so it can adapt to coming off that med. So, there are women who can then come off of it because they want to come off of it for their pregnancy and do so successfully with the right support.
Right. Yeah, I think that is so important, is recognizing some of these medications have really intense withdrawal symptoms, right? And they're really uncomfortable physically and mentally. And so there's a lot of ways working with a trained provider to do it safely and also with less side effects, right? Less of the withdrawal.
Because it's about that neuroplasticity, really. It's about the brain adapting to this change. It's adapted to the medication. Now it has to adapt to not having the medication. And, it's frustrating to me that really that this withdrawal from simple things like SSRIs is really not recognized. It's absolutely a thing. Not everybody goes through it, but it absolutely
Would
can.
you say the majority of people have withdrawal?
I think people who stop, a higher dose suddenly, yes. People who are able to taper, people who have good nutrient status, have the building blocks in place, like foundational things like omega-3s, magnesium, there's more to it, but that makes a huge difference. So it does depend.
Yeah, it's so interesting. So I think, the whole point here is just to really be inspiring for women listening that may have mood symptoms and are wanting to be their best, entering motherhood and having healthy babies and caring for babies, right? As new moms, having healthy mental emotional state is so important. And there's so many ways to get there.
Yeah, there really are. And I mean, it's just coming to mind, for example, vitamin D, like so important, so important for mood, sleep, for baby's brain health going forward. Risk of autism is impacted a lot by that, right? So, and I just think that's a simple thing that can be optimized, either before pregnancy, or if you find out in pregnancy it's low, you can fix that right away. And these things are so important. And I want your listeners to be empowered to know, like, we can impact this,
Yeah. And then, the other thing I see is when I do check for people's vitamin D levels and they're low, and they might even be taking a vitamin D supplement and or even getting outside and getting some sunlight, and they still have low levels. That is very much indicative of leaky gut issues, right? Like they are not, absorbing vitamin D or manufacturing vitamin D effectively, right? So
there can be, but there's a lot of reasons that can attribute that someone has a higher need for a while for vitamin D. And there's a lot of vitamin D receptor genetics that influence that. And for some people, reaction to a component of wheat is a big factor in causing low vitamin D. So, it is the main thing first is to get that level up. And then they may not always need that same level of supplementation if they address some of those underlying causes.
Right. And then the quality of vitamin D supplementation they're taking, right? How well is it absorbed through the delivery system, Yeah,
fat-soluble vitamins. People all need to have some fat with their food, for that to be absorbed.
Right, exactly. So these types of things are, or even like getting outside and getting some sunlight without having sunscreen on, right? Because
knowing what time of the year you can actually manufacture vitamin D, right? Like, I'm in Northern California, and at this time of year, no one's making vitamin D. Like it's only going to be, the summer and the shoulder months and in the middle of the day kind of more. And people are phobic at this point about the sun. And so they're totally depriving themselves of that ability to manufacture, where you can get exposure and then put your sunscreen on so you don't burn. You can give yourself 15 minutes or 20 minutes, arms and your legs out, and have a massive impact on your levels.
And I do that with my son as well. Like I put him outside for a few minutes before putting sunscreen on him because I want him to make his vitamin D as well. And children need healthy vitamin D levels. So I think, unfortunately, we have been really brainwashed that like, oh, if you're going to be outside, you have to immediately have your sunscreen on. And, it's not safe to get any sun exposure without protected skin. And it is about that balance. Like, yes, you can't be outside for hours burning your skin and causing skin damage. But we do need to. But the sunscreen will inhibit that vitamin D production.
Absolutely will. Yeah. It is a problem.
Yeah. Awesome. Well, do you have any last thoughts that you want to share with the audience? How can they get in touch with you or find out more about you?
Yeah, I have a guide of like overlooked causes of depression, anxiety, because I feel really strongly like I want people to know that these things might be contributing to their symptoms so that they can be empowered to start to take action on those. So it's a free guide. It's just a several page PDF. It's at drtracymccarthy.com/top 10. That's TOP and then the number 10. And that's a great way to learn more, and it's easily digested, no pun intended there. And then my practice website for people who are in California and are looking for functional medicine is drtracymccarthy.com. And then I have an online program, The Natural Mood Solution, which is an educational program for learning more about these root causes and what you can do on your own. Before you ever see a practitioner, you may never need to see a practitioner.
I love that. It's just really that education that's creating the empowerment so that people can really understand, like, why do I feel the way I feel, and really giving hope to that hopelessness.
I'm all about the hope. I have a sign on my wall here that says "Stay hopeful" that a patient gave me. And I'm like, yes, exactly. Because there's always more we're learning. There's always more we can do. And so don't give up.
Don't give up. Oh, well said. Dr. McCarthy, thank you so much for coming on the show today.
It was a pleasure. Thank you so much for having me.
Well, I hope you enjoyed today's episode with Dr. Tracy McCarthy. It was really important to really understand the link between the gut-brain connection and how a lot of psychiatric and mood disorders can be connected to an imbalance in the gut and the dysbiosis with the microbiome. So we delved deep into all good things, bacteria and gut health related. And I think it provided a lot of valuable information. So I'd love to hear your thoughts and what you gleaned from this conversation. And if you want to learn more about Dr. Tracy McCarthy, you can find her on the web at drtracymccarthy.com or on Instagram and Facebook at Dr. Tracy McCarthy.